The primary purpose of Uniquely Human, the podcast, is to educate and inform. The views expressed during all episodes are solely those of the individuals involved and do not constitute educational or medical advice. Listeners should consult with professionals familiar with each individual or family for specific guidance.
Uniquely Human, the podcast, is produced by Elevated Studio. Music is graciously provided by Matt Savage of Savage Records.
Hi, I'm Dr. Barry Prezant, clinical scholar, researcher, and consultant on autism and neurodiversity, and a Brooklyn boy raised in the big city.
And I'm Dave. I'm none of those things, and I grew up on a farm in Illinois. But being on the spectrum myself, I have plenty of personal insight to lend.
And this is Uniquely Human, the podcast, a show that illuminates and celebrates autism and neurodiversity. Today on Uniquely Human, the podcast, we are having a discussion about a topic that so many of our listeners have asked about. And for the longest time, I've been searching for the perfect person to talk about sleep issues in autism and neurodivergent children and adults. So welcome, Dr. Beth Malow.
Thank you. I'm glad to be here.
I'm glad you're here because I'm on 5 hours of sleep for the last 3 nights. So I'm interested to hear what you have to say.
Yes, that's for sure. So a little bit about you, Beth. Dr. Beth Malow is a professor of neurology and pediatrics in the Vanderbilt Sleep Division and holds the Burry Endowed Chair in Cognitive Childhood Development. Dr. Malow is board certified in neurology and sleep medicine. She previously served as vice chair for research and academic affairs within neurology and vice chair of the governor-appointed Tennessee Autism Council. Well, pretty full schedule there. She also served as principal investigator for Vanderbilt's Autism Treatment Network, one of the regional autism centers across North America that develops standards of medical care for children with autism. Prior to joining the faculty at Vanderbilt, Beth was a tenured associate professor of neurology at the University of Michigan and director of the Sleep Medicine Fellowship Program and General Clinical Research Center Sleep Program. She is also the parent of 2 autistic individuals and co-author of Beyond the Politics of Contempt, Practical Steps for Building Positive Relationships in Divided Times. And we're also interested in hearing about that new work of yours as well.
Needed more than ever.
Yes, for sure. Divided Times. It goes without saying. So, our listeners are very often interested in the journey of our guests. So if you could talk a little bit about your professional and personal journey and what brought you to focus on both neurology and sleep disorders.
Well, thank you. It's such a pleasure to be here, Barry. I would say that even as a kid, I was so interested in how the brain worked and what made people tick. And my brother was a psychologist, and I would read all of his books, right? And like B.F. Skinner and different books as I was growing up. And I thought about medicine because I thought, wow, it'll give me all this opportunity to really focus. And initially I was going to be a psychiatrist. And yet I was also interested in kind of the brain aspects. And some psychiatry is that way. I don't want to make it sound like it isn't, but there was something about neurology and focusing on the brain and really drew me in. So I became a neurologist. And then after my kids were born and diagnosed with autism, I moved from actually just being a general sleep person to being a sleep and autism expert. Sleep, of course, interested me from the get-go because I was so fascinated by what happens when we dream and how when we sleep, it seems to improve every aspect of our lives. And then I kind of tagged on the autism later.
Yeah. You know, as a speech language pathologist, when I've consulted to schools and programs, and a teacher would say, this youngster comes in so dysregulated. It just seems, I was guessing at the time, but for many years I would just say, well, how does he or she sleep? And very often, of course, we would hear not so well. So how common are sleep issues in autistic individuals versus the general population?
Yeah, so sleep affects probably about two-thirds to four-fifths of people with autism. I've
Hmm.
seen rates as high as 87%. I would say there are some kids who sleep well, but they're in the minority. Maybe, I don't know, about 20% of kids with autism may not have any sleep issues, but the
Ah.
rest do. It's very common. Oftentimes we see this overactivity, this I can't turn my brain off, similar
Hmm.
to what we see with ADHD type kids. And then they also have a lot of medical issues, maybe on antidepressants or other medicines that affect sleep. So there's lots of reasons why kids on the autism spectrum may struggle.
Hmm.
That's interesting because I'm absorbing all of this. Ever since my teens, I have not been somebody who just lays down, goes to sleep.
Mhm.
And once I'm asleep, though, I almost have waking inertia, meaning when I'm awake and I can't get to sleep. But when I'm asleep and I cannot wake up. So I, it's interesting to me that the autistic brain in particular would have would not have maybe the same override circuit that other just non-autistic brains might have that say like this is the time when we downregulate, this is the time when we start drifting off, now we're asleep. I make it sound like it's that easy for everybody, but I assume it's not just that easy for everybody, correct?
It's true. It's what you're describing is very common, and it is amenable though. Like if we can teach our brains to calm down, we can actually help ourselves to sleep better. And I just look at autism as an exaggeration of that. I mean, even those of us not on the spectrum
Hmm.
certainly have had that experience, whether good or bad, of some event happening. And it might be a talk that I give. It might be tonight after today's podcast because I was so excited with how it went. And our brain just keeps replaying it. And
Hmm.
even good things can create that over arousal, that hyper arousal that can interfere with sleep.
Sure.
Hmm. Yeah, and what's coming to mind? I think so often, in a very simplistic way, people think about, well, you're awake or you're asleep, but you're really shifting states of consciousness. And I didn't really raise this as something for us to discuss, but it's that there must be phases or stages of moving into sleep and then coming out. And I remember very clearly a young autistic girl many years ago that I consulted for. She was non-speaking when she was awake, but she would sometimes speak coming out of sleep. And it sounded like more scripted kinds of things that were somehow stored in long-term memory in her brain. But that shifting, if you could comment on that a little bit about sleep not being you turn the light on, you turn the light off.
Right, right. There's a whole stage of sleep. We call it N1 sleep or stage one or light sleep. That it's really interesting because when you're in that, you can still remember things like, oh, yeah, I snore. Because some people will snore as they're in sleep and they remember it. If they're in deep sleep,
Hmm.
they're unconscious. But if they're in that lighter stage, they remember, oh, yeah, I was snoring as I went to sleep, or I saw some image as I went to sleep. We can give people things to remember. And sometimes they'll remember things even though their brain activity looks like they're in light stages of sleep. So it really is a very interesting stage to be in. And then as we're waking up from sleep, we sometimes will wake up abruptly, but more often than that, we'll go back into lighter stages and then fully wake up. So there is, you're absolutely right. There's different stages of sleep. There's dream sleep, right, where we have most of our dreams. It's called REM sleep. There's lots of different transitions in and out.
Mm. So you gave us that astounding number of about, give or take, 80% of individuals on the autism spectrum have some sleep problems. So why don't we begin to talk about the impact of that? It's not just that, okay, there's an isolated problem, but it affects us in so many profound and
Oh,
broad
yeah.
ways. So if you could talk about that a little bit.
Yeah, I like to frame things as a positive. I look at sleep as a window or a vehicle to help autistic individuals with their lives.
Hmm.
Because if you think about it, it's so easy, particularly if you're a parent of a teen on the spectrum and they're not sleeping well and they're having meltdowns and they're struggling at school and they're up at all hours of the night. It's easy to say, well, they're aggressive or they're not able to cope and focus on that, and then they get put on some of these drugs with a lot of side effects, right?
Hmm.
But if we can shift it and say sleep affects everything, and not only will you sleep better, which creates better physical health and mental health, it can actually improve how you deal with the world. And the example I love to give people, regardless if they're on the spectrum or not, is to say, how do you feel when you haven't slept well the
Hmm.
night before? Are you more apt to send that snarky email, right? Or post or whatever, right? That you are going to regret later. And
Yeah.
the answer is everybody starts nodding and they know exactly what I'm talking about and how
Yes.
dysregulated we all are when we haven't slept. So then I say, well, think about the autistic individual, and we know that their brain circuits are already overwhelmed and they're more apt to lash out already when they're stressed. And if you add on sleep deprivation, it can make things even worse. And people are like, oh, yeah. So that's when I say to the autistic individual or their parent, if we can focus on sleep, it's not going to only help sleep, it's going to help everything,
Hmm.
every
Um,
aspect of your life. And that's so important because that will then motivate them to get the help they need.
well, it also sets up for success when you haven't had a day where you just threw grenades at people all day long. Because
Yes.
even though we all do it, and me probably more than others, but even though we all do it, um, we still feel bad about it at the end of the day, and then we're regretting, and then that's going to ultimately affect our sleep, and then the cycle continues. But when you have a day where you're like, you know what, I put in the work today, I did a good job, I was agreeable, and blah blah blah. It makes a huge difference. It sets up a different loop.
Mm.
Absolutely.
Mm.
Yes. Very well said.
Yeah, and I'm thinking about the fact that for some people, you could say I'm having a really irritable, low frustration tolerance day, and you could reflect on that. But when I think about so many people on the spectrum, especially kids, they could be having a really bad day, but it's almost like you can't pin it to, oh, I didn't sleep that well last night, which
Right.
probably gives you a little bit of a distance from it in a sense. And just by the way, it's not so much a confession, but full disclosure, I was diagnosed with severe sleep apnea a few years ago. And thank goodness CPAP works beautifully with me. I mean, but I wasn't so much irritable as walking around like a zombie probably for months and months and months until I realized that was it.
I
And
remember that. I remember you saying you were struggling because you felt like you were in a fog. To the rest of us, we were just like, nope, he's still banging on all cylinders. So it's very you
It's
masked
all
it very well.
relative, right? Yeah, no, I know. And you made me remember a paper that I read. I'd have to find the reference. The idea that it's not only irritability and aggression or just feeling snarky when you communicate with others, it even affects our ability, like our social, what's the word? Just social communication has
yeah,
been impaired. And that's one of the core features of autism. So even the core features are affected by sleep. How kids are doing in therapies, right?
Mhm.
All of that can be affected by sleep and improved by sleeping
Mhm.
better.
And the ups and downs, the kids who come in from home who might be fully charged up in terms of their arousal level, and then they crash, at 11 a.m. in the morning, and then after lunch they're up bouncing, but that arousal, I guess OTs call it the arousal modulation issue, that you're just kind of bouncing all over the place like that. Goodness.
Absolutely.
Yeah.
Yes.
So, what I think one thing that would be very interesting is if you could reflect on the changes in how we view sleeping problems now. In the past, if a kid was having an irritable day or pushing back or being quote unquote non-compliant, it was thought of as a behavioral problem.
Mhm.
Um, but now, especially with so much more knowledge about the biomedical underpinnings in autism and sensory issues, how has that changed the way we understand the problems and specifically in how we assess some of those issues and try to address them?
Yeah, this is a great question. How do we really assess individuals on the spectrum when they're struggling with different daily functions or social interactions? And yeah, I mean, I think sleep is top of the list. I mean, there are others as well, of course, just to be complete. Constipation or reflux or a lot of GI problems can play a role. Really, any medical problem can play a role. Pain can play a role. I know sometimes I'll overexercise and I'll strain a muscle, and I'm just not as nice as I usually am, right? It affects me.
Yeah.
I think sleep is truly up there, and it's important to explain that to people how much you've slept or the quality of sleep that you've gotten. Like with sleep apnea, you may think you're sleeping all night long, but under the surface, if you're untreated, you're having these ins and outs of sleep, and it's like almost your alarm going off several times an hour to wake you up.
Hmm.
All of that is going to impact your daytime functioning. And I think making that connection for people is really, really important because then they start thinking, oh, what do I need to do to improve my sleep? And maybe I should prioritize my sleep over taking a medicine for irritability or aggression.
Hmm. That issue of prioritizing sleep, it's, uh, I'll share a little bit of background here. Yeah, I had a wonderful dad, passed away a number of years ago. Um, Never even graduated high school, but he referred to himself as a practical psychologist. And he would always say, your health comes first. And on top of your health coming first, your sleep comes first. And that was just kind of folk knowledge at the time, but I've held on to that as a mantra. So important, for I think both for parents to hear that and for all of us to hear that that the prioritizing so important. One other aspect that's kind of interesting, and we talk about individuals who might be preschoolers growing into the elementary years and beyond. Do you notice any patterns in sleeping issues and how you would approach sleeping issues depending upon the chronological and developmental ages of the people that you see?
Yeah, I think as we get older, things change. When kids are really little, there's a lot of night wakings, and it could somehow be just signaling. For example, when I say signaling, they wake up, they're scared, they don't know where they are, they
Mm,
don't know what to do to go back to sleep, so they'll call out for their parents. Not so much when they become teenagers, because they they can get up and get on their phones or whatever, right? So I think things do change as we get older, and I've also seen kids move from um, just these random night wakings and difficulty sleeping to, as they get to be teens and young adults, there's a big focus on the worrying. Like, I'm
mm,
anxious that I'm not going to be able to get a good night's sleep, or something bad is going to happen at school or work tomorrow if I don't fall asleep. And I mean, we all see that even in non-autistic individuals, that ruminating and that worrying that, something is, we're just going to be not ourselves. And that's where, when we do treatment, cognitive behavioral therapy for insomnia, it's called CBTI, can be very effective in these populations, because that's really what you're getting at, is that changing the cognitive part is changing people's views about their sleep, and that, yeah, maybe I'll be a little tired tomorrow, and maybe I'll even fit in a power nap if I need it. But I'm gonna make it through. I'm gonna be okay, and then I'm gonna sleep the next night better. I think that is really important.
I'm curious about the power nap.
Okay, so my
Yes.
son taught me this, right?
Uh-huh.
I was, as a traditional sleep specialist, I was giving my patients advice. Don't try to sleep past 3 o'clock in the afternoon. Don't take a nap because it'll mess you up that night,
Yes,
right?
that's what I hear. Yeah, yeah.
And yet, I think it's correct if you're talking about a 30-minute nap. My son has taught me I could take a power nap for 10 minutes. And I've
Oh,
done this as late as 5 in the evening. Like, let's say I'm going out that night, or I have something I have to do, like a podcast that evening. I find that 10 minutes is amazing. It resets me, it resets my mood, it resets my energy level. Another possibility is, if I can just, like, lie down, even if I don't fall asleep, it's not as effective as if I do fall asleep. But even lying down for 10 minutes and closing my eyes, sometimes I have like this heated eye mask that I'll put on, and and I find that to be very effective. Sometimes I'll couple it with a walk. So after I've done my power nap, I'll go out and walk, and that will bring my energy back up. But just that little reset, uh, can make a huge difference. So now I'm a big believer in the 10 or maybe 15-minute at most power nap. And one of the things I love about working from home is I can be seeing patients, and then I'll get a gap in my schedule of 10 or 15 minutes, and I go and I say to my husband who's working next door, "Hey, honey, I'm going to take my power nap now." And then he knows to leave me alone. And I set my timer, and I put my phone on silent, and I get my sleep.
my
So
goodness.
can
Yeah,
you walk me through the process of that? Because I've tried power napping, and as soon as I set the timer, there's a voice in my head that says, well, you've only got 10 minutes. Now you've only got 9 minutes. Better get to sleep. Now you've only got 8 minutes. Better get to sleep. It never works. But then if I don't set the timer, like I said, I'll be asleep for 12 hours.
I don't know. Airplane mode, I can find a way that it will still ring, but it will somehow silence it, or I turn the volume off on my phone, but it still rings.
But you but you
I
you
yeah,
do set a timer,
I
like
do
you'll lie
set a
down.
timer, but it's not like I don't look at it once I set it. I know what you're talking about. Like, I'll wait to set it until I actually get into bed, because if I set it and then I like go and find my eye mask, I'll get all upset because now I'm down to 14 minutes rather than 15
Right.
minutes, and now I'm not going to have enough time to sleep, right? So
Right.
I try to make it the last thing I do before I get into bed.
Okay.
But it works. I mean, I really credit my son with this, because I really thought it was going to affect my sleep at night, and it
Huh.
doesn't. It just gives me that extra boost of energy to get through the day when I haven't had a good night's sleep. I think the other thing that does is, I know when I'm not sleeping well at night, I know, all right, well, I'll take a power nap tomorrow, right? It gives me the confidence to know that I'm not gonna, die, that I'm not, because I'm not sleeping right now in the middle of the night. I'll just get through it, and tomorrow will be a better day.
I must say you've just relieved decades of guilt for me, because early in my career, when I was hospital based and I was supposed to be developing a communication disorders department, well, I actually did do it in a children's psychiatric hospital. I used to feel so guilty because after lunch, I would fall asleep for 15 minutes in my office. And I've never let go of that guilt. I was saying, you were terrible. I can't believe you did that. Now you just relieved all that guilt just like that.
I'm so excited. Well, if that's what I accomplished for you today, Barry, I am really, and who knows, maybe some of our listeners are also feeling, oh, good, my naps. I mean,
Yeah.
think about Europe. People go and they do their naps, their siestas after lunch. It's brilliant. They close all the businesses
Yeah.
and I mean, I really do believe we can learn from the nap.
Yeah.
Yep.
So what are some of the low hanging fruit issues in the sense that sometimes some simple suggestions can really make a big difference, especially for parents who might be listening right now?
Yes, so there's a lot you can do. There used to be this myth, or maybe there is still a myth, that if your child is on the spectrum or you're on the spectrum, it's these behavioral approaches aren't going to work. And it's so wrong because they are.
Hmm.
And in fact, I've seen kids do better with the behavioral approaches if they're on the spectrum than if they're not. I'll say that
Mm.
again. If you're on the spectrum, you might actually do better with some of these approaches I'm going to bring up.
Hmm.
The number one is a routine.
Yes.
Autistic people love routines. They're really good with routines. For a kid, it might be a bedtime routine with a checklist, or it might be the PECs, the visuals. The idea is to know what's going to happen before bed and make it really predictable. So I'm going to take a bath, and then I'm going to use the bathroom, and then I'm going to put on my PJs. And then including for parents who've got kids that we used to call Asperger's, but now we're, very what's the word? Very, I'm going to say this in a positive way because it is, self-determined, really know
Yes.
what's best for them, want to be in control. Give them an option. You're going to either get to listen to music or you're going to get to read a book, and
Mm.
and they can pick and they can choose. So I think the bedtime routine is super helpful. A lot of autistic individuals are very visually based,
Mm.
strength wise, so they really find that valuable. So that's probably number one. The second thing is to delay bedtime, even by 30 minutes.
Hmm.
Sometimes there's this whole concept in sleep called the forbidden zone, and what it
Mm.
is the 30 minutes before we're ready to go to bed is when we're most awake. So if we
Mm.
go to bed too early, we actually interfere with our ability to go to sleep. Think of the airplane you have to catch in the morning, and oh, I'm going to go to bed at 9 o'clock tonight instead of 10:30 because I want to get that extra sleep. And what happens is you can't fall asleep. It's too close to your bedtime. You're too awake. 9:30, you're not asleep. 10, you're not asleep. 10:30, when you would normally go to sleep, you're not asleep because you've been fidgeting, you've been
Mm.
moving all tossing and turning. So um, really, that I think illustrates the fact that if you try to force yourself to go to bed earlier than your brain and body are really ready, it's going to be self-defeating,
And
right?
that's a toughie because that flies in the face of logic. You think I'm going to
Yes.
go to bed earlier, I'm going to get more sleep, and I'll be better prepared. But you're saying not necessarily.
It's not. It's not. And it flies in the face of two other issues. One is that our school start times are insanely early.
Mm.
We're trying to push, one of the advocacy things I do is to push for later start times, so like 8:30
Mm.
for high school and middle school. But so there's that. And then parents, I mean, if I were to make that recommendation to one of my parents in clinic and say, well, let's just put Johnny to bed at 9 o'clock at night instead of 8 o'clock at night and see how he does, and explain my charts and my graphs and forbidden zones. Chances are, if that's all I say, they're just not going to come back,
Hmm.
because it's hard on the parents. Instead, what I add is a question: do you think this is going to work for your family? Or
Hmm.
how can we make this work for your family?
Hmm.
Do you need to have Johnny be watching a video, earlier in the day, early in the evening while you make your school lunches, while you have some time to just prop your legs up and relax? which will then allow you to have your sons go to bed a little later when they're really ready to go to bed, because you've given yourself that, 30 minutes or an hour of time that you need. It's so important. That's one of the recommendations to delay bedtime, where the kid is always like, "Yay, Dr. Mallow, I love you," or Dr. Beth. And the parent is looking at me like, "We are not coming back. We are not coming back." And so I think that a lot of these things, what I've learned over the years is they work. The challenge is to get people to do them. And part of that is something that, I really love, which is respecting the autonomy of the parent and the child, or the teen, or the individual, the young adult on the spectrum, being able to say, this is a two-way street. I'm gonna suggest to you some things that I think might help. I want to hear from you what you think, because if we don't talk together, if I just tell you what I think and tell you what to do, it's not going to work. I want to hear what you think and what you think is going to work for you or for your child. And that's something that has really been very helpful in my work, in my career.
I have a question. I know I ducked out for a minute, but I'm back. We'll edit out me saying this, but I did catch what sounded like a very important point. So for the purposes of the episode, here's the question. And one thing that I'm curious about is two things is I know that you have to be consistent, especially with any habit or behavior, but certainly with sleep. Your body just says, pick a lane here. Are we going to bed late? What is the time of day that we're going to bed? And I know that helps. I've heard, we've had other guests on the podcast. I've read things that they say there's rules, right? Like no food 3 hours before, no screens 1 hour before, no, arguments with your spouse 2 hours before, whatever the factors are. In your experience, are these more or less hard and fast rules? Or are they kind of just folk wisdom, like Barry mentioned before? What's your take?
Yeah, I think they're folk wisdom. I actually find that very funny. I feel like I could see a cartoon and it's like somebody is getting ready for sleep and it's like 3 hours before, stop fighting with your spouse. 2 hours before, right?
Apologize to your spouse 1 hour before.
Right. I think everybody's different. So in addition to making sure that I engage the person and the parent in these discussions and really hear what they're thinking and how this is going to work for them, I think the other thing is just to, as part of that, make it as personalized as you can for someone, because not everybody's going to respond to a weighted blanket, right? And not everybody's going to respond to soft, calming music. In fact, I have some teens and young adults on the spectrum who I take care of who fall asleep with rock music. I kid you not. Like, this is what they need to hear, to have their brain turn off. So rather than telling people what to do, I ask them what they think might work for them. And I'm not afraid to implement that. I do have kids who fall asleep with the TV on. I know it's really bad. Sometimes I'll suggest they put a blanket or a sheet in front of the TV so they don't get that stimulating light, but they're still hearing it and it's still comforting to them at some level, because they're anxious and they need that background noise or whatever. So I learn something new every week that I'm in clinic, and I work with them because there's a reason that they're listening to rock and roll as they're trying to fall asleep.
I'm smiling ear to ear here because, and maybe you use these terms, but what you're describing is person and family-centered sleep support. That you want to know the routines of the family, the values of the family, because we know that parents are not going to necessarily carry over with suggestions if it flies in the face of the family culture and the family routine. And you're also saying every person's an individual. We have to come up with individualized plans as opposed to here's the prescription to follow.
Absolutely. Yeah, for two reasons. One is it is personalized, and what works for you or me is not going to work for Dave or someone else. And number two, people are going to buy into it more if they feel like they're being valued as individuals who know what's best for them. And that's really what I've carried on, whether I'm doing videos on melatonin safety for parents, even the new book I wrote, Beyond the Politics of Contempt, is this idea that really puts people in the driver's seat regardless of whether they're autistic or not. But one of the things I really admire about autism, from an early age, seeing it in my kids, seeing it in the families I treat, is this strong self-determination. And this is what's important to me, and not necessarily being steered into the peer pressure of, well, this is what I'm supposed to be doing. And I think that that's a virtue, right? To have that identity.
And from the parent perspective, by having them collaborate with you, it gets away from the blaming.
Oh, yeah.
And I hear that so often, even from, teachers and therapists that I really respect. If a child's having difficulty in school, oh, they're probably not putting them to, and the blaming, it's the parent's fault because we don't see it. It must be something that's happening at home that leads to this child coming in so dysregulated in the morning.
Absolutely. I remember one of my sons, like, he loved to touch little girls' hair, right? Like, I'm on a podcast, but imagine touching little girls' hair. Yeah. And they decided that he was doing that because I wasn't spending enough time with him because I was working too hard as a doctor.
Nice.
And it was really ridiculous. And it just made me feel awful, right? There was so much shaming and blaming and all these quote unquote disruptive behaviors that your kids are having. So I really feel like one of the things that has helped me be so successful in my practice with families is there comes a time, like usually 10 or 15 minutes into the session, where I reveal that I have sons on the spectrum, and it's like a wall goes down and they're like, oh, you get it, you understand. And it's my superpower in a way, because what I'm basically saying to them is, yes, I've been there with you. I've been through the disruptive, the fact that you're not a good parent and all those other things that we've had to deal with, in addition to the autism, right? Which sometimes are even harder than the autism, dealing with all of that.
Oh, well, absolutely, because autism doesn't blame anybody. People blame people. And it's like,
Right.
the last thing parents need is to have, well, first of all, to deal with blame. That's no fun. But then problem with that is it gets into your head somehow, and now you start wondering, like, man, I should feel guilty about this maybe or not, but even just being plainly misunderstood or dismissed as being the problem, unbelievable. Both of my parents worked, a farmer and a teacher, and I didn't touch anyone's hair. It has nothing to do with whether or not your parents work.
And here's the deal. We went out and we got him a fuzzy blanket from the store, and we Velcroed it onto a shirt. And that solved the problem. It was a sensory thing, right?
My sensory thing, yeah.
I was already spending a lot of time with him, but I didn't spend any more time with him. The time, it's incredible. And I know that they're well-meaning. I really do. It's just, I have so many stories of just how inappropriate people sometimes are, even though they're well-meaning. Oh my
God. You're a lot more gracious than I am, because I question whether people are well-meaning or if they're just. Anyway, let's leave it on a positive thing. They are well-meaning. Let's go.
Well, speaking about a positive thing, Beth, I heard you speak on another interview or maybe presentation that you gave that, the good news is there are a lot of things that can be done. You've already discussed some of those. So can you kind of come across with a a message that maybe parents especially would see as hopeful, given the challenges that a sleep deprived or a child who's an inconsistent sleeper may pose for, for the parents as well, for their own ability to have a good night of sleep.
Oh, yeah. I mean, there's a lot we can do. I can't think of any child I haven't helped throughout the last, I don't know, what, 30 years I've been doing this. There's, first of all, let's hunt for the medical issues, right? I
Hmm.
mentioned the GI problems, seizures, sleep apnea. Let's really hunt for those medical issues. What medicines is the child taking that might be interfering with their sleep? And then after we do that, let's try some behavioral approaches. The cutting out the caffeine, increased exercise,
Hmm.
getting them off their phones, making sure that they have that bedtime routine in place, figuring out ways that a parent can interact with a child. And I can tell you more about a bedtime pass in a moment. That really speaks to the child's autonomy and focuses on rewards rather than punishments.
Hmm.
Um, and then sometimes we do use medicine. I'm actually a big proponent of melatonin as long as you use a safe, reputable brand.
Hmm.
There's also some new things coming down the horizon. I've seen some success, for example, with magnesium glycinate
Hmm.
supplements. And sometimes we use medications that are stronger. That's okay. I look at them as jump starting the sleep patterns. Like if you can help a child fall asleep easier, then you can get a routine in place because the parents sometimes are so overwhelmed they need something to help their child fall asleep that's stronger than melatonin or magnesium, and that's okay, with the idea that we'll get rid of that medicine down the road once they have all those other things in place like the routine. The
Hmm.
the bedtime pass is one of my favorites for kids who have some language and also want to be in control. And rather than having your child in their room trying to fall asleep and not ignoring them, letting them cry it out, whatever. I like this method where they have like a little card. It's called the Bedtime Pass. Pat Fryman put it together for typically developing kids. He was a pediatrician, and it basically is a ticket. So it's something the kid likes. It could be Dora the Explorer or some Moon and Stars card, but it's a ticket. They can turn it in for a hug or a glass of water or another bedtime story from mom and dad. But if they don't use it, if they just keep it all night long, stay in their rooms, stay in bed, which means they're probably going to fall back to sleep on their own, they get a reward in the morning.
Hmm.
And it's not really a bribe. It's like a security blanket almost, and it gives them an opportunity to be strong and to be a big girl or a big boy. And I can just have this pass, and if I need it in the middle of the night because I'm worried about the monsters in the closet, it's there for me to use. But if
Hmm.
I'm really strong in the morning, I get a reward for being a
Oh,
big, and it's just beautiful, and it doesn't involve punishment.
Hmm.
And it's up to the child to decide, I'm going to use this or not. And it's just so fitted to self-determination, right? And
Hmm.
so anyway, that
that is
wanted to get that
brilliant.
out. Yeah.
What a strategy. So similarly, we had this was my wife's idea. Our kids during their waking hours, we gave them mental health passes, meaning any day that you're at school, if you're experiencing anxiety or if you wake up that morning not feeling it, um, you don't have to go to school that day. Now, you'll get like one every 3 months or one every 4 months, but like you've got a mental health pass. So just keep that in your back pocket. And it really helped them throughout the weeks when they would be having a really busy or chaotic week. Just knowing that they had this get out of jail free card or whatever. I didn't even think about applying that to a nighttime scenario of like because we had one of our kiddos definitely woke up a lot every night and came into our room and it was what it was, but I think that's a fantastic strategy. And as far as like the routine of getting into it and setting yourself up for success, just anecdotally, what I've noticed for myself now that I'm 48, I'm starting to understand how my body works. And I know that if I haven't exerted myself that day with some form of strength exercise, cardio, or whatever it might be, I'm just far less likely to get to sleep easily and stay asleep. And so I think another piece of it, when you're kids, I think there's a lot more opportunities to bounce off the walls and run around. But as the kids get older into their teenage years, it's like
Yeah.
you can't be sedentary and then expect to get to sleep right away.
Absolutely. I'm glad you mentioned, Dave, the exercise, because I think that is still another piece that I really stress. Sometimes I'll say to a family, is there any time that Johnny ever slept and slept well? And they'll usually mention, well, when he's in camp and they're running around all day and
Hmm.
swimming and whatever, he comes
Yep.
home exhausted and he sleeps really well. And I'm like,
Right.
okay, let's use that to our advantage. So, yeah, I'm a big believer. I'm the same way. I've got to move in some way every day. And it makes a huge difference. And it's good for our health. It's good for our mental health too, to do that. Stress reduction. Yeah.
Hmm.
Yep.
So,
Totally agree.
so what I'm hearing is there's no one magic bullet. There needs to be a plan in
Mhm.
terms of life routines, exercise, medications if needed as part of a bigger plan.
Mhm.
Um, it's just so essential because human beings are very complex in so many different ways. What's going on in your
Yes.
head and what's going on in your
I
body.
will I will say one thing.
Mhm.
Sometimes it's really simple. I've sometimes seen families latch on to the I'm just going to try to delay bedtime by 30 minutes or an hour. I've actually seen that work
Mhm.
like wonders or the bedtime pass. So I don't want families to feel like, oh my goodness, I'm going to have to do all of these different things.
Good point.
Sometimes when a family is overwhelmed, I pick one thing for them to work on. I should say they pick one thing for them to work on. I'll give them some choices.
Yes.
And I've been amazed. I mean, they'll come back in 3 months and say, we've delayed Sally's bedtime by 30 minutes. And she started falling asleep and she's doing great. And I'm like, great. So sometimes you're right. Most families need the plan. But some families just put one or two simple things into effect and it's like night and day.
And the low hanging fruit. What could they own and implement,
Yeah.
and be motivated to do? That's great. Beth, are you available to be my sleep doctor?
Yeah.
If you live in Tennessee, I don't know. I can see anyone in Tennessee or who can travel there.
I will be
Because the
traveling there.
challenge is, I know I can't, I mean, that's the way Vanderbilt works and it's fine. But yeah, I can see anybody as long as they're in Tennessee.
So Barry, here's what we need to do. This will be a win-win-win-win, a four-win situation. You
Okay.
and I
Hmm.
need to buy a very affordable cabin in Tennessee,
Hmm.
start paying some utility bills so we can claim it as an address. Your son can move there,
He is
live there,
moving there.
live there rent free,
Yeah.
and then we can avail ourselves of Beth's services.
Ah, that sounds great. Okay. So when I need a good sleep consult, it'll have to be out of my little cabin. How about in the Smoky Mountains?
Sounds good to me. I get
I'll
very good
come back.
sleep
You
in the
know what? And
mountains.
did I mention I can come to the cabin in the Smoky Mountains and treat you and enjoy the Smoky Mountains. So
Oh,
there
now
you
that the cabin is in the Smoky Mountains, now
go.
Beth is available to come.
That's great.
As long as it's in Tennessee, right?
Beth, thank you so much. This has been just eye-opening, and I knew that our listeners would come away with a wealth of information that they can really digest and apply as needed.
I
So
enjoyed it so much, you guys. This is the highlight of my week.
that's great. Thank you.
Excellent. Thank
Take
you.
take care. Be well.
Bye bye.
Bye bye.